Hi, everyone. You guys weren't kidding when you said you couldn't see anything up here. I feel like I'm at my dance performance. I can't see the audience, but anyway. Thank you guys for being here. My name is Callie, and here with Dan, who, I'm going to say it, you are a superhuman. He's doctor, dad, co-founder, all of the things. So if anyone needs a doctor, we have one in the room. Do you want to just dive into it?
Sure, let's go for it.
Okay. So we had so much to talk about with the healthcare industry and remote and what that means. So to start, just in general, within the healthcare industry, what does remote look like? What does the adoption of working remotely look like? Talk to us about all of that.
Sure. So we were talking just backstage, just beforehand. A lot of what we've been talking today, we've been talking about remote as it's not equal. It's that it is equally distributed across industries, and that's obviously not true. So I come from healthcare, which is an industry which has been classically very slow to adopt remote work. But even defining healthcare as an entire industry is, once again, overgeneralizing what that is. There's many different parts of that. I come from a health tech part of that industry right now, but I also still practice as a pediatric emergency medicine doctor, which is a very different environment from the health tech. So when we talk about these different industries, I think that there's a lot of nuance inside of each one of them that has a lot to play with all the things that have been talked about today. So if we're talking about healthcare itself, like the actual delivery of healthcare, I would say the uptake so far and the opinion so far has been very much divided. There has been this huge change, as we've talked about a lot today with the COVID pandemic, where suddenly almost a large percent of healthcare had to go remote immediately through telehealth or other mechanisms, which has drastically changed what the perception is of this kind of movement over that time. So I'll give an example. So in an emergency department before COVID, that we would never have even dreamed of providing care remotely. But now somewhere between 2 and 5% of our patients who actually show up actually see a remote provider even when you've come for an emergency. So there is this change that's going on. If you looked at the curve of that adoption, there was this huge uptick where about 75% of all healthcare visits were remote during the initial part of the pandemic, and it's come back down now to closer to about 10 to 15%. But prior to this, it was in the sub 1%. So there has been a big change in the perception of how this is going to move forward. So I do think that there is the beginning of a feeling within healthcare that we can do this providing of that. And then once again, as we were talking backstage too, I think it's very much role-based within the providing of this kind of industry, where if you're talking about, say, a EHR analyst that needs to do some work changing something in our medical record, well, yeah, that person can probably be remote. But if it's someone who needs to do chest compressions on a patient coming in, probably not the first thing that we're going to do remote-wise.
Yeah, gotcha. So I think one of the big things that comes to mind with healthcare and being remote is just geography in general and how there's a constraint there or how we could potentially remove that constraint. So want to just get into that aspect, how does that affect being remote, security, privacy issues, things like that?
Sure. So just like I was talking about how on this theme of not all industries are the same, so healthcare and several other industries, defense, education, other things, have a lot of regulation associated with them. And regulation often can be a stopping point or at least a bottleneck of adoption of the kind of technologies that we're talking about today. However, I do think that there are places within these industries where those things can really strive ahead, and the organizations that do that can, I think, go in a big way. I'll give a couple examples. So for instance, in our company, which does clinical decision support, basically we change doctors' decisions in real time inside of their workflows. To be able to do that, we have to integrate into the EHR itself. However, When I do that, the EHR companies have very specific rules about what kind of engineers can actually access those type of systems, not even just the data, but their systems themselves. So roughly about 75% of the world is like immediately taken off the map for us, and we have to very specifically do in certain kinds of countries to work in those kinds of things. The other part of that regulation, especially in our industry, but also under other industries as well, is around the privacy security aspect of things. So we are covered by HIPAA, which a lot of people understand is the privacy regulation that governs how you move data within the healthcare industry. But a lot of people get confused thinking that that's very much just related to the actual healthcare providers, say the hospital systems or the EHR companies, but it's actually also defaultly covers any company that they have BAAs with. So if you are a health company or you are even just a technology company servicing the healthcare industry, you are covered under their privacy regulations. And those regulations also have in place with them where those people can be, how they interact with you, what kind of licensure they have to have, what kind of encryption that you have to have on your devices. All that kind of stuff is very highly regulated, that has kind of changed where in the world we think about hiring people and how that can happen.
And I mean, backstage too, you were talking even further than that, like the restrictions within roles, within states, within, do you want to add anything there as well?
So once again, we tend to think of the United States as like a completely open system across, but a lot of the regulation is actually at the state level in these kind of industries as well. So for instance, if I go into Nevada, I can't practice emergency medicine in Nevada. I have to go get a licensure in Nevada. That takes another 6 months, a whole lot of paperwork to do it, and there's a whole sorts of states. So to be able to hire someone remotely and have them immediately perform, you have to have a whole understanding of that industry to be able to figure out exactly how that's going. For a long time, we have had remote work in certain parts of our industry that are classic. So radiology is a classic one of those, where you can update, you can take the data from a radiologist, say an MRI, send it somewhere else in the world. A radiologist can read it there and send it back. However, that radiologist needs to be licensed, not just in my country, but also in my state, right? So yeah, they can live in Australia and have their kind of life there, but they still need to follow the regulations of where that patient is. So there are a lot of nuances inside of there. I do think that is changing. So already there's new regulations where multiple states, so there's actually a consortium of many states that are now accept licensure from other states. There's new countries that are accepting things like that, so you can actually have people in different parts of the world to do those sorts of things. And I also believe that there's new technology that can sort of give back to the end clients that you may be servicing a better feeling that, hey, my employees that I'm hiring are going to follow the regulations that you need to follow to meet the requirements of the laws in place.
Yeah, so I'm like all of this with the regulations and the certain nuances makes me think, and I'm assuming some other people, and I kind of just had this assumptive question. So healthcare, like the healthcare industry will never be fully remote. And
yeah. So I was trying to push back on that. So as much as I've in the past 5 or 10 minutes said, hey, this is going to be a problem, hey, this is not a place, I actually think the healthcare industry is very ripe for this change. And I think that we're just coming to the beginning of a point where we're going to start to see more and more of that. Yes, the pandemic pushed us into a momentary increase in the delivery of care that way, but I do think that there's a new wave that's going to come in, especially on how we hire all of the people in these roles in the near future. So a couple of examples of that. Telehealth is an easy example of that. For the entire history of the delivery of medicine, it has been very geographically constrained. So as a doctor, it's like literally as far as I could walk was the distance that I could provide care. But a lot of those things I think are very much breaking down now. Telehealth is one aspect of that, but there's many other services that are being provided that can be done remotely. So for instance, there's lots of eye surgeries that are now done remotely. Other surgeries, of other kind of robotic surgeries are done remotely. And there's a new movement where the person who's actually doing the physical aspect of healthcare is local, but the person who's providing the knowledge work of that is remote. So for instance, we were talking backstage, I was giving the example of the patients who come and see me. I still relatively believe that 95 to 98% of them could be seen by a nurse practitioner with support from a clinician and protocols on top of them. So I do think that we are entering this moment in time, and especially I think those healthcare providers are entering a space both economically as well as culturally where they're going to be willing to accept remote work in that place. So I think that the people who are providing, especially providing specific types of remote work to these industries, I think this is the time where those companies are going to really start to see some adoption in there.
Awesome. And once that does start to happen, like, what do you see as the biggest advantage of the healthcare industry going towards that remote?
Yeah. So the healthcare industry has, as many people know, is classically siloed. It's very geographically constrained as we've gotten into. And because of that, there is a huge variability of how we provide care and also who is providing that care. I think you're going to see in the healthcare industry a huge consolidation and scaling of the providing of care in the next 10 to 20 years. So it's not like, surprising that places like Amazon suddenly now have bought an entire healthcare company that was based in San Francisco. They bought One Medical this last year, and they're going to start providing Amazon care throughout the country. You can see where that is going, right? There's just an obvious push towards that. My other big interest is in the hospital at home program. So a lot of people haven't seen a lot of this, but a lot of the care that we've classically provided in a hospital or a clinic, there are new technologies that are going to allow us to provide a lot of that care at home. I do think that this is not an overnight shift, but I do see the very financial pressures changing to push towards this. So I think that we are definitely in a place in the near future where we're going to see a lot of the stuff that we talk about today in this kind of conference enter into these kind of industries where classically everybody said, no way, we're not going to do that, right? I'll give a metaphor for that. So if you had gone to a large academic center like where I work in the peninsula, and you had said to them, hey, let's take all of this data that you have and put it in the cloud, they would have laughed you out of the room. There's no way that's possible. Now, almost every single of these very similar kind of hospital systems are doing that exactly right now. Because they have seen the economic benefits of moving to the cloud. I think the same thing they're going to see in this kind of distributive workforce of the things that we're talking about today. I think COVID has bumped us towards that and really kind of made it such that now is these opportunities for these siloed industries for people to come in and do that kind of stuff.
Well, so one more question before we give you guys a chance to ask Dan some questions. Kind of more on the Curbside Health, just building a remote team as you are currently doing and with Curbside Health in the healthcare space.
Yep.
Like, what are the biggest lessons learned from that experience?
Yeah, so a couple of those lessons learned. So first of all, when I went into this, we have my co-founder is a physician as well, and a technologist, and we both came into this. We were like, oh, we are going to need to have healthcare specific talent to be able to build this company. And to be honest, that has just not panned out. Most of the talent that exists out there, ours is a highly engineering product. It does not necessarily matter that they have the expertise in the technical realm to do this. Yes, there's integrations that need to happen, but those are relatively quickly learned, and with the advent of open sharing platforms like GitLab and GitHub and things like that, the ability to quickly and to interface with these things has made that a lot easier. There's also new protocols within healthcare specifically that have majorly simplified all of this. So that kind of concern or that classic statement, oh, you can't really build these kind of companies with just generalized people, I think that has completely gone away from my way of thinking, as long as you have people within your company who have those skill sets. The other thing, which gets back to what I was talking about before, is I thought that I could hire anybody anywhere in the world, and that is not true in the healthcare space. There are regulations that I need to follow. So being able to say, hey, I can slice and dice the world by where there are high patent security, that matters a lot to me because I simply can't interface with the EHR companies unless I do that. And then finally, our company has been completely remote the entire time. I do say that one of my other kind of lessons that I've had is that when we very first started our company right before COVID, it was extremely difficult for us to do a lot of our processes because we had to go to the hospital systems themselves. Like, we had to go to Springfield, Illinois. We had to go to like Augusta, Georgia, to like actually interface with our clients, both sales-wise, but also like engineering and getting into the room with them. COVID has completely switched that. We do none of our sales in person anymore. It's completely remote. We do all of our technical infrastructure and team building, and everything we do is all remote. It's completely changed the entire way that we've been able to do it. And to be honest, it is something that we otherwise couldn't do. As you were implying, I have 3 kids less than 6 years old. Like, I can't necessarily really be doing that. If I hadn't had the ability to hire remote talent and do all of this remotely, I simply like could not have built this company.